set to get started. I will turn it over to you, Lori. Thank you.
Thank you, Lisa, so much, and good evening, everyone. It is really such a pleasure to be able to present this evening and also to see all of you in attendance. Some of the names I do know, some I do not. So I just wanted to give a moment to introduce myself. My name is Lori Bumbaco. I'm an oncology dietitian, and I've been in practice for over 20 years. I work at the center, and I have several responsibilities. One of them is to present programs, just like the one you've registered for tonight. But I also co-facilitate a couple of our healthy living groups. And I do also meet with individuals one-on-one. So that is an important part of what I do at the center. And that's an interesting segue that I want to share, that this evening I'm giving you sort of a general overview. But ideally, the best guidance comes from a one-on-one consult, right? Because everyone is unique and everyone's situation is unique, and you deserve tailored nutrition advice. Okay, so do keep that in mind as I present this information to you this evening and I go through the slides. And I think if you're curious to learn more or to really optimize the cancer protective properties of your diet, the best bet is to meet with an oncology dietitian and perhaps me at the center. So if you have questions, you can just kind of drop them in the chat and Lisa will help moderate that. I've included my email at the very end of this presentation, so that forces you to stay on so that you can reach out to me directly. I welcome that. So thank you again for being here and for your interest in what I do for a living. It's my passion, and hopefully that will come through this evening. Very much part of what I do in practice is helping people navigate all of the information that they encounter related to diet, nutrition, and cancer. So this is my opportunity to highlight the most common myths that seem to persist over the years, as long as I've been in practice, and really kind of set the record straight about their origins. Maybe there's some shred of truth to the myth, but then really to kind of give you the bottom line and the final takeaway of each of these myths. Okay, so just quickly, the alphabet soup after my name as well. I have a master's of science in nutrition and dietetics. I'm a registered dietitian. The CSO stands for Board Certified Specialist in Oncology Nutrition. So as a dietitian, I can really see anyone related to medical nutrition and clinical nutrition interventions. But my passion is oncology. It's all I've ever done. It's all I ever will do. And I'm also licensed to practice in Illinois, which is a good thing, right? Now, this image you see, this photo, I wish I took it personally, on this cover slide. I'm going to talk about it in just a few slides. And I wonder if anyone wants to guess what this flowering plant might be from. You get bonus points if you get it right. And no one's going to hold it to it, so I'm going to trust you. But we're going to come back to this because it's a really interesting story about this particular plant that I thought would be important to share with you today. Okay, so as we go through the presentation, I'm going to start first with putting all of this nutrition misinformation and put it into context. So really kind of highlight for you and raise your awareness about the problem of nutrition misinformation, especially in oncology care. And then we're going to get right to it, what you're here for. Dive into the top 5 most common diet and nutrition myths in oncology care, and then share some resources, especially those reliable, dependable ones, especially at the very end of the presentation that you can take a look to just really expand on the information that I share today. Okay, so misinformation, have you heard about it? Do you know we're living in an age of misinformation? Well, as it relates to nutrition misinformation, what I want you to think about is that it's this information related to nutrition that is inaccurate or potentially incomplete that can mislead us. And there could be several reasons why it's inaccurate or complete. It could be just simply negligence. It could be an unconscious bias that someone holds that's sharing this information, or just even an honest mistake. So nutrition misinformation has plagued us since the beginning of time. And I promised I would come back to that plant, and it is a potato plant. Wasn't that a beautiful little potato plant? So they were once thought, did you know this? They were once thought to have been the cause of leprosy and were actually banned in parts of Europe. Well, then came along this gentleman. His name is Antoine Augustin Parmentier. And he was born in 1737, and he was a French army pharmacist. And he turned himself into what some people describe a potato evangelist. And that's actually a bouquet of a flowering potato plant that he's holding in his hands. He was actually a prisoner of war in Prussia during the 7-Year War. And as a prisoner, he was forced to eat potatoes because they were just given to prisoners because they were causing leprosy. So who cares who eats the potatoes, right, if they're a prisoner? But what do you know? When he was released, and when the war ended, and he was released, he was perfectly healthy and he did not have leprosy. So he, when he left prison perfectly healthy and well fed, he was furious about the fact that in the French Parliament that potatoes were banned. So he really made it his life's mission and his entire scientific focus to give some favor back to the potato. And what he did is he found, and he was awarded several honors for discovering how potatoes themselves are an excellent source of nutrition. And they actually helped individuals who were recovering from dysentery, which also plagued people at the time. Now, he tried several ways to get the public to enjoy potatoes again, but as you can imagine, that fear lingered. He gave bouquets of potato flowers to King Louis and to Marie Antoinette. And the royal family wore potato blossoms with them in the public, but the country still shrugged it off. So what he decided to do is he took a plot of land that was gifted to him. And what do you think he grew? He grew potatoes. He had a big old potato patch. And what he did is he hired heavily armed guards to make a show about protecting his field of potatoes. And so anything so well guarded, he assumed, had to be valuable. And right there changed the public perception. And I don't know, hopefully you agree potatoes are something delicious and nutritious to enjoy even today. But a nice little backstory about how sometimes we have this false information or misinformation about foods, and especially as they relate to disease. So we might want to consider this one single example, and there are several others, but we might want to consider it as we approach any information that we receive, and keeping this in mind. Okay. So a little bit more about misinformation in cancer care. Since 1980s, my profession as an oncology dietitian, it really kind of blossomed. And we learned a lot about lifestyle and diet and its relationship to cancer and cancer risk and recurrence as well. Now, unfortunately, most of our survivors, and this is present day, most of our survivors report in surveys that they aren't able to follow the cancer nutrition guidelines that are recommended to them. And you might wonder why that is. Well, many of them report that they feel overwhelmed. They are overwhelmed either with the amount of information that they're getting or just their situation in general. They have so much information that they encounter that they're not really sure what to believe. And despite this, however, many survivors, as evidenced by the amount of you in attendance tonight, many survivors believe that food is an important component of their cancer care. And I hope you agree that that is absolutely a critical component of your care. So if you've ever asked, what did I do that caused my cancer? Was it something that I ate? Is there something I need to eat to protect myself? You've come to the right place. I'm here to help you. So a recent systematic review, this is probably a few years now, it has found, and this is no surprise, that poor quality and inaccurate nutrition-related information is prevalent on websites and social media. How prevalent? Well, up to 80% of the information that we find online and in social media related to nutrition is not accurate. So let's just assume basically all of it, right? 80% is a lot. Now, a recent study, and this was just published this year, it found that 93% of individuals who were just recently diagnosed that they were exposed to at least one type of misinformation, 93%. So that misinformation tended to include things about treatment, but it also did include about diet and lifestyle. Now, keep this in mind, you might be susceptible, this is just based on the research done so far, you might be susceptible to nutrition misinformation if you yourself feel vulnerable, if you lack trust in your providers, or you just don't trust science in general, if you have a reduced knowledge about the subject matter, if you have lower literacy, or if you have conspiratorial thinking, then you might put yourself in this category of being exposed to this information and tending to believe it. Now, if you've ever asked, did I eat something or should I avoid things because I now have cancer? I wouldn't be surprised. I added these on this slide today, and it took seconds to find some of these images. Some of them are actually from trustworthy websites. Some of them you may be familiar with, you may have encountered, you may have seen others. These are all really good examples of how these messages are so concerning that it's no wonder why you might feel that something you did caused your cancer and that you need to be afraid of certain foods because it's going to make your cancer recur or progress. Again, I'm here to set the record straight for you. So I want you to know that no single food causes or cures cancer. If you heard me say anything tonight or hear me say anything tonight, that's the thing I want you to hear. Okay. So if you're eating dinner, enjoy, you can tune out. Okay. But please know that no single food causes or cures cancer. But we have a good amount of evidence that actually shows a diet pattern, which I'm going to talk about a little bit in our first myth, a diet pattern filled with a variety of vegetables, fruits, whole grains, beans, and some other plant foods. This may help lower our risk for many cancer types as well as cancer recurrence. So that body of evidence comes from the World Cancer Research Fund as well as the American Institute for Cancer Research, sorry. So when you get these slides, you can click on that link. And if you want to know more about how your current diet measures up to this evidence base, you can consult with a dietitian like me, or you can do like a self-assessment. They actually have these tools. So I want you to click on this link and explore that more for yourself if you're interested. Now, I just want to take a moment to speak about this as well. Research has found that for anyone who has encountered cancer treatment misinformation, that it can lead to distress, self-doubt, and decisional regret. And relationships and social support can also suffer for people with cancer because of disagreements over this misinformation. I see this very often in clinic with spouses or with other loved ones. And there's emerging evidence that suggests that those individuals with cancer may have a twofold increased risk for death if they abandon evidence-based guidelines for false cures. Okay, so this is a real problem that we want to avoid if at all possible, right? At the same time, when misinformation is addressed, especially for treatment decisions, and sometimes that includes diet as like an ancillary component of that, this could increase survival by more than 5 times, especially among certain cancer types. So hopefully you recognize we need to really acknowledge that misinformation is a problem. It can be distressing, but there's some solutions and there's ways that we can help ourselves. Now, why do myths seem to be so common in cancer care? I think it's because of the diagnosis itself. It's frightening, it's personal, there's an urgency to help oneself, right? So misinformation that promises hope, certainty, or safety, that can be very tempting to believe, of course, and I wouldn't blame somebody for it, right? But very often misinformation stems from isolated case reports, a lab study, and they oversimplify that. There's dramatic headlines that are meant to grab our attention, and they rarely, any of these isolated cases rarely translate to reliable evidence. They're not what we see in terms of the evolution of evidence. It takes time. It's less attention grabbing and it's far more nuanced. Okay, that's why you very often encounter the misinformation and not the evidence-based guidelines. So cancer itself, you know this, it's incredibly complex. The evidence may not necessarily apply to you, right? Think about how unique your situation is. And recognizing patterns of misinformation and finding reliable sources are the best bet. That's why you're here today. So thank you. So my goals for this evening are to improve your confidence about accurate information related to the common diet and cancer myths, hopefully to reduce your fear around certain foods, because the last thing I want is for you to be afraid to eat. Learn how to identify misinformation and use critical thinking. And then understand that the diet pattern is a more effective strategy than singling out any specific food in order to reduce your risk. Okay, so let's dive into these myths. This is what you're here for. And I'm going to start with, hopefully you kind of get an idea of what they might be if you didn't read the program description. But from these images, hopefully you get an idea of what I'm going to be speaking about in the next 45 minutes. So I'm going to start with the one that is the most popular, the one that I talk about every single day in clinic. And I don't get tired of it because I love to help people understand what I know. And it's about sugar. So have you heard this one, that sugar feeds cancer? Chances are you have. So more than a century ago, Otto Warburg made a discovery. It was a great discovery at that time. That tumors consume tremendous amounts of glucose compared to non-cancerous cells. Now, glucose, if you weren't aware, it's the term that we use to include the final breakdown products from all the different types of carbohydrates that we could possibly eat. So just a quick review of carbohydrates. They include starches, natural sugars, and added sugars. So sweet potatoes are starches, for an example of one. Wild berries are an example of a food that has natural sugars. And soda is an example of a beverage that has added sugars. Now, of all the foods with carbohydrates, some are more nutritious than others. I know my audience. I know you can look at that list and identify which ones are more nutritious, right? Now, at the same time, some of the foods that have carbohydrates might be less nutritious, but they are delicious. Some of them, you might agree, and deserve a place, therefore, in an overall healthy diet. Now, how much and how often? That's what a dietitian can help you work through. Now let's dive deeper into this myth. So does sugar feed cancer? Technically, yes. Cancer cells do like to eat a lot of sugar. So that begs the question, if we don't eat sugar, we can starve our cancer, right? Well, not so fast, because here's the thing. Cancer is not a picky eater. Cancer will eat anything. And research, especially since the discovery 100 years ago, we've learned a lot. We've done a lot more research since that time. And research has shown that cancer cells can use the breakdown of protein, which is amino acids, which also are stored in our body. Cancer can also use fatty acids, which are the breakdown products of fat and also is stored in our body, among many other metabolites besides just sugar. So it doesn't solely feed off of sugar. Does it eat sugar? Yes, but it also eats everything and anything, right? So we now know that everything can feed cancer, not just sugar. And if we falsely assume that if we can starve a cancer, I ask the question, what's left? Because I mentioned some carbohydrates like sweet potatoes and wild blueberries that are on a cancer protective food list. And if we're eliminating sugars and all carbohydrates because they break down into sugar, then what do we eat to protect ourselves? There's nothing left to nourish our body and to build a strong body and mind. And that's often what we want to focus on. What can I eat to reinforce my non-cancerous cells and help them work as best as they possibly can? So here's the whole story about sugar. Scientists have since found, since 100 years ago, that different parts of the tumor can actually process nutrients differently from different foods. So it's like this really evolving, complicated, dynamic thing that's happening, especially inside solid tumors. Cancer has been shown to adapt and to alter many of the pathways that influence its own metabolism. So the result is this really complex and dynamic and constant reprogramming of metabolism driven by oncogenes and tumor suppressor genes. So some of you probably know that terminology. Those are very powerful and potent. And no diet is really going to influence those genes, right? So we want to keep that in mind. Okay. The researchers call this, and they use this terminology, metabolic flexibility. Now that's high level. So you know what I know and what oncologists know. And you could use this if someone dares to share with you that sugar feeds cancer. You can say, well, did you know that cancer is metabolically flexible? I want you to use that, okay? So really what that means is that cancer has this flexibility to its metabolism. It can eat anything. It's not like it only chooses one thing. And if that's removed, it's not going to function as well. unfortunately, right? And actually we tried to test that theory out where in clinical research, they had some interventions where they have shown that cancer cells can adapt when they attempt to deprive those cancer cells of glucose. It adapts and it just uses something else. So the simple statement of sugar feeds cancer does not come close to justifying our current understanding of how complex cancer cells' metabolic environment is. And dynamic, again, it's constantly changing. So being afraid of eating sugar is potentially harmful for you. I want you to think about this. If it increases your anxiety, if it causes you to avoid a social situation where there might be a sugary food included, or if it results in some sort of cycle where you feel guilty or ashamed because you ate sugar in your past or because you once in a while occasionally enjoy some sugar. That's no reason to feel guilty or ashamed. Here's what I do know also, that not eating enough carbohydrates may cause some weight loss, and it certainly can lead to malnutrition. That's already prevalent. This is why I have a clinical practice. This is prevalent and concerning for some cancer types. That's the one thing we want to avoid is weight loss and malnutrition, especially during active treatment. So malnutrition itself independently predicts worse outcomes for someone who's diagnosed with cancer. So someone could technically have a curable cancer, become malnourished, and they will not do as well. That treatment will not work as well. Did you know that even if we reduce sugars and the carbohydrates that break down into sugars, if we reduce or eliminate them in our diet, our body is designed to convert the protein that we eat in our diet into a form of a sugar as a compensatory mechanism. Now, not a lot of people know that. I'm going to speak to this actually in our final myth. So stay tuned because I have a little bit more to share about that. So what do the experts recommend? Based on the evidence, experts recommend that if we consume a mostly whole food plant-based diet, that's what's best for cancer protection. They contain a variety of different foods that have an abundance of nutrients and these unique compounds called phytochemicals, and they help us to build a healthy, resilient body environment that makes cancers less likely to thrive. Did you know a plant-based diet is technically mostly carbohydrates? Okay. Experts do recommend, however, that we put limits on the less nutritious forms of carbohydrates, like added sugars in the diet, as well as sugary beverages. So when someone comes to me concerned about sugar, we may just investigate a little further about those two things and try to put some limits on them. As it turns out, sugary beverages and high sugar diets are just not as nutritious, and they eventually may lead to inflammation as well as elevated levels of insulin in the body, especially for someone who gained some weight in their midsection, sort of that apple shape or that belly fat. We find that higher levels of inflammation and insulin can occur. And eating that way may lead to that type of weight gain in the belly. Now, inflammation, you probably have heard of that word as well. And insulin, especially high levels of insulin, this plays a more significant role in cancer than does the sugar that we eat. And there are effective strategies to lower inflammation through lifestyle, as well as lower insulin levels potentially through lifestyle. And that's, again, what a dietitian can help you explore if that's a concern of yours. So keep in mind, two things can be true at the same time. We can limit or even avoid added sugars and sugary beverages while also consuming a nutritious diet that's associated with cancer protection. And we can also eat sugar as part of a nutritious diet that's associated with cancer protection and not be afraid about it causing us any harm at all. There is no single food or beverage that causes cancer. The total diet pattern matters the most. And dietitians like myself advocate reducing excessive amounts of added sugars and limiting sugary drinks as much as possible. So I wanted to come back to this list, I promise you. So this is from the AICR. Again, you can click right on that link when you get these slides. These are among the top cancer-fighting foods. This is just a short list. There's more to include. But when you see these foods, hopefully you think nutritious, healthy, and hopefully you think delicious. If you're feeling like you're a little less confident about how to prepare these foods, guess what? Dietitians can help with that as well. Okay. We're going to move on to the next myth. Hopefully I settled the story on the sugar one. All right. So dietary supplements. And I'm including some of these images because they are really what I found when I Googled supplements and cancer. So vitamins can kill cancer. That's news to me. Is this a myth? It sure is. So supplements, are they necessary for cancer treatment? So just a little bit more background about supplements. So they are defined as products that is added to the diet. That's the operative word there, supplement, right? It's usually taken by mouth as a pill, a capsule, or a powder. There's a few myths within this myth that supplements are necessary for cancer treatment. The first is that supplements are necessary in order to help fight the cancer, right? Help treat or manage the cancer. Supplements are natural, so therefore they're safe, right? Because there's that assumption. That word natural sounds really encouraging and promising, right? And safe. And supplements will boost my immune system. I heard this one just today, just a few hours ago. Boost my immune system. And that could be a whole nother myth because we actually can't boost our immune system. I mean, we don't want to boost our immune system, as it turns out. So those are some of the myths that I'm going to talk about within this myth. Okay. So did you know that the industry itself is a multi-billion-dollar industry? Sometimes I think I'm in the wrong profession. So how many individuals who have been diagnosed take at least one dietary supplement? If you're in the audience and you're raising your hand, it's probably 70% of you. That's what surveys show. Now, why? Why are people, when we ask individuals, why are you taking a dietary supplement? They respond with some really appropriate answers. They thought they were helping themselves. They thought it was necessary. They thought, again, there's that boosting my immune system. I thought that's what I needed when I'm on my immunotherapy to give me energy or to just help me manage some of the side effects that I have during my treatment. Where might people have heard this type of information? Probably online, social media, maybe a friend, maybe they read it somewhere. So we want to revisit where we heard that information, right? Here's the whole story about dietary supplements. So there's a couple concerns: safety as well as lack of efficacy. Do they even work? Let's talk about that. So supplements themselves, how they are manufactured, sold, and used, are overseen by both the FDA and the FTC. The responsibility for ensuring that supplement products are safe before they're marketed is assigned to the manufacturer. Did you know that? That to me sounds like a conflict of interest right off the bat. Because I think if I were to make my livelihood selling something, I would say that they were safe and that they worked, right? If it meant I was going to make some money. Now, essentially, supplements, therefore, are available on the shelves at our disposal until they cause harm. That's basically the way the system is set up right now. Concerning. Okay. So on average, we see about 2,500 adverse events that are reported annually related to dietary supplements. And what are these adverse events? Well, they're pretty significant. Vomiting, diarrhea, shortness of breath, rashes, joint and muscle pain, blood in the urine. The list goes on. But I would not want any of you to have to deal with any of these issues. There's up to 70,000 calls annually to U.S. poison control centers that are traced back to a dietary supplement. And did you know that supplements like Chaparral, Ephedra, Seneca, and Comfrey were once available to U.S. consumers, but they are unsafe and they are now banned for sale because they have case reports of liver damage, kidney failure, fatal heart attacks and death, strokes, seizures, and even psychosis. Very concerning, right? So this image here is Chaparral. And I just want to give you a little history about Chaparral. So in the 1970s, and the NCI studied Chaparral tea and tablets, and they looked at its main ingredient, which is nordihydroguaretic acid, or let's just say NDGA for short. And they asked 45 people who had advanced cancer to try and use it regularly. Of the 45 people that were included, 4 found that their tumor responded and their cancer got smaller. And that effect lasted between 10 days and 20 months. So really exciting, right? This would make me want to try some Chaparral if I were in that situation. But what do you think happened to the other 41 individuals? Their tumors actually grew and got bigger. So a review has shown about Chaparral ever since that it can cause severe irreversible liver damage and liver failure. It can also cause kidney damage in some people. Now, why am I picking on Chaparral? I do believe it's still available for sale. A lot of these banned supplements are still available for purchase, whether it's international, whether it's even what's in the product, who knows. But I just want you to be aware that supplements are not necessarily safe. Okay. So here's what we know about supplements related to cancer. There is evidence that some supplements have the potential to cause harm. And that's based off of two pretty large trials. And these are always on my board exams when I get recertified. I have to know about this stuff. So the SELECT trial, this was back in the 1990s, seems so long ago. That SELECT stands for Selenium and Vitamin E Cancer Prevention Trial. And they took men and they divided them into two groups. And the men who were taking vitamin E were eventually, and this was a prospective trial, they were at an increased risk for prostate cancer. And men who had higher levels of selenium in their body and also started taking a selenium supplement were also at an increased risk for prostate cancer. In this trial, they chose selenium and vitamin E because of preliminary data suggesting that selenium and vitamin E were cancer protective, especially for prostate cancer. So they thought the hypothesis was, well, then a lot of these vitamins and minerals must be very healthy for us or very cancer protective, right? Not so fast. What we learned from this trial is that the dose is the poison and too much is what the concern is. Then there was another trial, the ATBC trial, the alpha tocopherol beta carotene cancer prevention trial. And this was another prospective study where they took individuals in Finland, I believe it was, and again in the 1990s, and men who smoked while also taking a beta carotene supplement had an increased risk for lung cancer. That was like counterintuitive. You would think that the beta carotene in the supplement would protect someone who's smoking, right? But they found the opposite effect. So that with both these trials, I promise you, they just ended them early. They saw they were causing some harm, so they closed down the trials. They said, we got to close up shop because we're causing harm. Now, here's another important takeaway. So not only is the dose the poison, but also that food has never been shown to be problematic. And a dietitian like myself can tell you where to find vitamin E because there's actually 8 different isomers in food, not just one. There's 8 different isomers of vitamin E. I can tell you where to find selenium in food, and then maybe you even know yourself. I can tell you how to increase the carotenoids in your diet. And that's going to guarantee you some level of cancer protection, but done in a very safe way. So what about treatment itself? So a lot of our supplements are metabolized in our liver using a system that they call cytochrome P450. And prescriptions, as well as the treatments used in oncology care, they very often use that very same system. So there could be the potential for an interaction, and it may increase or decrease the concentration of the drug. All right, so it may decrease how effective the drug is by reducing the concentration of it, or it may increase the side effects of the drug by increasing the length of time that the drug stays in our body. So just some examples of imatinib and irinotecan, they're among some of the cancer treatments that are reduced, so their effectiveness is just rendered much less if someone's taking St. John's wort. And I will share pretty much across the board, we discourage St. John's wort for most people who are taking prescriptions. It interacts with a lot of things. Now, there are some other supplements that may interact with this system, Allium sativum, Panax ginseng, ginkgo biloba, just for your information. But if you are thinking of taking a dietary supplement or are taking them, just please inform your healthcare team because they can review any potential interaction and just advise you safely. Antioxidants themselves, they in a supplement form have not been shown to be effective in treating cancer. In theory, it makes a lot of sense, but hasn't panned out with research. There is a potential for interaction. Again, the dose is the poison. It does depend on the type of cancer, the mechanism of action of the cancer treatment, as well as the type of antioxidant that's being used. Now, some supplements that act like antioxidants should be used carefully for those people who are on treatment. So in clinic, we always caution their use, just as a precautionary principle. And this, I think, is especially true for someone who We know that their treatment's going to cure them. Why would we interact with that treatment, right? It's just some examples of antioxidants are vitamin E, selenium, vitamin C, and zinc. There's some others, but just for your information. So what do experts recommend in the end? High dose dietary supplements are very often not recommended for cancer prevention. There's just no evidence to show that they've been helpful, and in some cases, they've been shown to be harmful. So we aim to meet nutrition needs through diet alone, and that's why a lot of dietitians will be heard saying food first and supplements second for optimal nutrition. There are almost always exceptions, right? So sometimes a supplement may be recommended, but do not just automatically assume based on any misinformation that you encounter that you need them. Discuss with your care team if you're taking any or if you would benefit from using them. And that's a very open, honest conversation and a shared decision making with your care team. Hey, doc, do I need more of this? Can I take a supplement of it? And then you can have a conversation unique to your situation. Okay, next myth. Are we ready? All right, so moving on to dairy. And again, this is just an image. I just Googled dairy. I don't even think I Googled dairy and cancer because I'm seeing a lot of other false claims here. With psoriasis is a really good example that just happens to stand out to me. Psoriasis is an autoimmune condition, and milk and dairy doesn't cause it. There are like environmental triggers to autoimmune conditions, but there absolutely is a genetic component to autoimmune conditions. But anyway, so dairy. Let's talk about dairy. So dairy includes products made from milk, cheese, yogurt, ice cream, butter, and cream. The concern really links to a hormone used and is found in milk. So IGF-1, namely. IGF-1 is a hormone that's similar to the structure of the hormone insulin that we make in our body, and it plays a crucial role in the growth and development as well as metabolism of the animal that has IGF-1 in it. So too much IGF-1 in someone's body has been associated with an increased risk for several cancers, including breast, prostate, and colorectal cancer. So now you're starting to worry. You're like, Lori, is this a setup? Because you're telling me that IGF-1 is not good. So you're also leading me to believe that dairy is okay to have. Well, let's just stay tuned because we got more to share. Milk, particularly cow's milk, naturally contains IGF-1, and the concentration of IGF-1 in milk can vary, and it depends on a lot of variables, many, 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 many variables. The cow's breed, the age, the diet, so many things that I don't even think there could be a guarantee to know how much IGF-1 is in any milk that we consume or products made from milk. So even though milk does contain IGF-1, the amount is significantly lower compared to what our bodies already make. So our bodies make IGF-1 as well. In addition, when we eat and digest dairy, we actually break down proteins in it, and that includes IGF-1, and then we end up excreting it, right? So when we break down those proteins, we don't absorb as much of them. And what we do absorb doesn't affect us the same way that the original IGF-1 that our body already makes functions. There's a definite disconnect there. And at the same time, did you know that dairy has many nutrients that are beneficial to support overall health? Hopefully you did know that. Okay, so here's just a short list. Calcium. It supports our skeletal health. It helps regulate cell growth and differentiation. It potentially decreases the likelihood of cancerous changes. It is a nutrient of concern, so most Americans do not meet their needs for calcium. Same goes for vitamin D. It's required for skeletal health, but there's some unique properties to vitamin D in that it helps to regulate immune function. It is associated with the risk for some cancer types, meaning if someone's deficient in vitamin D, it is a nutrient of concern. Most of us are not consuming because it's not really found readily in the diet. So we might be lacking vitamin D as well. Dairy, especially if it's fermented, may be a source of probiotics. And I don't know about you, but many people I work with are interested in gut health, especially if they're on immunotherapy and they come to me with gut health questions. And sometimes fermented choices are almost always on that list, regardless of their reason for the desire to support gut health. So fermented dairy is an opportunity then to receive some natural sources of probiotics. And especially if someone's on active treatment and is advised not to take a probiotic supplement, it could be a great choice for them to naturally consume some food sources of probiotics. And that in turn may benefit our immune system. And there's also these compounds called sphingolipids. You're learning all this fancy terminology today. Which may inhibit cancer cell growth in many cancer types. So there's actually cancer fighting compounds in dairy. Okay. You might not have known that. So dairy is an example of how different foods might influence cancer risk through very unique pathways and mechanisms. So dairy is a perfect example where the situation is what matters, right? Circumstances matter here, okay? So there is strong evidence that dairy actually decreases the risk for colorectal cancer. Strong evidence, not just any, but strong. The experts are pretty convinced. Preliminary evidence also suggests that there is a protective effect of dairy for lung cancer. On the other side, there is some evidence that when someone in excess is consuming an excessive amounts of dairy products, it may increase the risk for prostate cancer. And there's a link there, so it doesn't mean cause effect. It just means there's an association, and they're trying to figure out more behind that. But that is something that I sometimes do explore with my men who have been diagnosed with prostate cancer. And in breast cancer, overall research does not show any link. It seems to be neutral, that there's no link. There's no increased risk for breast cancer, despite what you might have seen online or might have heard. So two things can be true at the same time about dairy. We actually don't need to consume dairy, right? It doesn't need to be an absolute on that list of cancer protective diet. And if someone decides to omit dairy for any reason at all, dietitians like myself can help them bridge the gap so that whatever they're missing in those dairy choices can be found in other food choices in ample amounts to meet their needs. But we can also consume dairy. We don't need to be afraid of it. We do not need to worry that it's causing us harm, and it can be included in an overall protective diet. I'm going to say it again. There's no single food or beverage that causes cancer. Dietitians advocate incorporating a variety of choices that can support our body with resilience, and fermented dairy, low-fat dairy can be included as part of that approach. Okay, I'm going to move on to the next myth. This is myth number 4. So organic versus conventional. Now, I just did a program at Cancer Wellness Center called Ask the Dietitian. It's a monthly program. We do it typically on the first Friday of every month, and it's virtual. And we pick a topic, and then you as the audience can submit questions to me that force me to answer them. And then I put together a presentation just like today and answer each of those questions. And for the month of June, we decided to choose organic as our Ask the Dietitian topic. And I included this quote for that Ask the Dietitian, which was recorded on our YouTube channel, by the way. So if you want to check that out, you certainly can. And this is from an organic farmer who calls himself the lunatic farmer for some reason. He's going to remain nameless for the sake of tonight. He's been quoted as saying this: if you think organic food is expensive, have you priced cancer lately? This could not irritate me more because this is insinuating that if someone did not eat organic food, they caught their cancer. And nothing could be further from the truth because we have zero, not even evidence, because all the research that's been done so far has shown that eating organic food does not protect us from cancer. Because I know that has happened. I've worked with individuals who have been diagnosed and ate organic, and they wonder why did they still get cancer? Because they've come across misinformation like this, right? And then the opposite can happen where someone's been diagnosed and they didn't eat organic food, and then they're left wondering and feeling guilty. Why didn't I eat organic? I gave myself cancer. And that is tragic because this is so inappropriate and false and fear-mongering that it obviously got me very upset. So let's break this myth apart. Okay, are you ready? So organic food, this is the myth, it's necessary if you're looking to avoid cancer, especially according to farmer Joe there. So the concern is that pesticides are chemicals that cause cancer. Now, logically, pesticides and herbicides, they can be toxic, right? And they can increase the risk of cancer if someone's exposed to high doses of them. Now, the USDA is the responsible governing body that regulates organic certification on food, and that little symbol in the top right corner is a guarantee that that product is USDA certified organic. How they define that is that the producers meet animal health and welfare standards. They do not use growth hormones, and they use 100% organic food, and they provide animals with outdoor access. I love that, especially on a day like today. Good for those animals. So organic plant foods are grown without synthetic pesticides and fertilizers, sewage, sludge, irradiation, or GMOs. So just so that you know, that all kind of fits under that umbrella term of organic. So here's what we know about organic food and cancer, and this is what I learned in school, some of our organic crops and produce may produce more vitamin C, iron, magnesium, and phosphorus than the conventionally grown ones. But here's the thing, we can easily eat all of those vitamins and minerals with other food choices, easily. Very easily. I would argue maybe magnesium is one that people have to work on, but most of us are probably fine in the others. And we don't need to eat organic only to get those additional sources. Okay. And again, that's where a dietitian can help. So organic produce, did you know, is not pesticide free. It is often grown using pesticides under the USDA's regulations. So basically, organic produce just uses organic pesticides. Market studies also show year after year that those pesticides that were conventionally grown foods, that when they detect pesticide residues, they basically can't detect them. They're definitely within safety tolerance limits, and they could mostly be classified as being organic because the amounts are so low. Wild, right? So what does the research then suggest? So the link with cancer risk and pesticide exposure depends on the dose, sort of like supplements here. So agricultural workers who are exposed to daily massive amounts of pesticides, they may be at increased risk for lymphoma. So certainly, if I were a farmer, I probably would want to work on an organic farm, right? However, for the rest of us, there is no strong evidence that the trace amounts of pesticide residues we are exposed to in our conventional choices increase the risk for cancer. We have no good data. And there is little scientific evidence that indicates that eating organic foods lowers cancer risk. Very little scientific evidence. The overwhelming amount of evidence, it's abundant, shows that if we just eat a diet with a lot of fruits and vegetables, including conventionally grown ones, that's going to lower our risk. That's going to help protect us from cancer. That's what the evidence has shown. So what do experts recommend? It is important to mention this. So we do want to wash our produce. So wash it adequately, not only to reduce those residues, but also some other pathogenic microorganisms that might be on them. So we want to start with washing our hands first in 20 seconds or sing happy birthday to yourself with warm water and soap, and then wash the produce for about 20 seconds as well. And all it requires is cold water, running water if you can. Cut away any damaged or bruised areas before you prepare or eat them. Rinse your produce before you peel it, right? So we don't want dirt and bacteria that could get transferred, like a melon is a good example, that can transfer from the outside in. So this is kind of food safety. Gently rub produce if you can while holding under plain running water. No need to use any kind of fancy soap or produce washes. Use a clean vegetable brush where you can to scrub firm produce and remove anything on the outermost layers of especially our lettuce varieties. Okay. Little information about food safety. Okay. So two things can be true at the same time. We do not need to eat organic food as part of an overall cancer protective diet. If we did, if the evidence showed that, that's what I would be advocating for you tonight, but I'm not. It's not necessary. However, you can eat organic if you want to. I'm not just going to discourage that, but don't feel forced in that you're getting any extra cancer protection, because there may be some other things that you could be doing and focusing on to optimize your cancer protective diet. Now, we can consume conventionally grown food in an overall cancer protective diet, and we do not need to worry that we are causing ourselves harm. Okay. No single food or beverage causes cancer. Dietitians advocate for personal choice. So it's up to you. If you want to enjoy organically produced food, I encourage that. If your budget allows, if you have access to it, absolutely. However, it's not necessary. Okay. We are going to work on our last myth. Did you think we would get here? Thank you for staying on for everyone who has. So fad diets, these come and go, right? That's the idea of a fad diet. And I just included, there's many, but I just included a couple today that I'm going to dive deeper into. So keto, I'm going to talk about last because it's another very popular thing. And this one on the right, Eat Real to Heal, just kind of struck me. I've talked about it in the past in a similar presentation. Eat Real to Heal. It's a book that actually, I believe, promotes the Gerson therapy, which if you're not familiar with Gerson, I don't want to open up a can of worms, but this is a very strict regimen. It involves juicing, it involves coffee enemas, and involves very heavy diet restrictions. So mainstream medical institutions, professionals like myself, National Cancer Institute have for decades now warned against the use of the Gerson therapy. There's no data or evidence to support its use, and it actually can be potentially dangerous because, as you can imagine, with juicing and enemas and strict diets, it can cause electrolyte imbalances, it can cause dehydration, it can cause infections, especially for someone who has a cancer diagnosis. So let's talk about more about fad diets. Okay. I want to talk about fasting because that's something that comes up often. It seems like in waves with people that I've worked with now. If you haven't heard of intermittent fasting, it involves the consumption of little to no food for a defined period of time. It could be as short as 24 hours of a fast or up to 6 days of a fast. I say no, thank you. That's a long time. But there's a popular diet that this one you may have heard of, the 5-2 plan. So you basically eat like you normally would for 5 days. And then for 2 non-consecutive days, you reduce how much you eat to less than 500 calories, which is very, very little food. And that's the 5-2 plan. And in theory, with basically anyone who's promoting a fast, the idea is that there's a reduction in insulin, IGF-1, and glucose. That sounds familiar? So while at the same time, there's an increase in ketones or ketone bodies, which forces cancer cells to use metabolites that are in a limited supply. So the cancer cells are kind of scrounging. They're like, what do I do? I don't have anything to eat, right? Sort of like trying to start that cancer again. Now, also in theory, it may increase oxidative stress as well as DNA damage specifically to cancer cells. So pretty compelling, right? Sounds like an interesting approach here. Now, here's the whole story about intermittent fasting that I want you to know. Side effects are common. I work with individuals who have done different fasting regimens. Hunger is certainly one of them. Intermittent fasting or fasting in general is contraindicated for someone who has malnutrition, someone who is losing muscle, losing weight, but mostly muscle. We have seen also reduced quality of life where individuals will report that they feel stressed, they are missing out on eating, especially during celebrations like holidays. And what's really important to point out, a lot of people are not aware of this, is that it's necessary to avoid excessively overeating on the non-fasting days, because if you do that, you're going to potentially negate any effects of the fast. So what's the point, right? And caution would be advised for anyone who has type 2 diabetes or someone who's taking hypoglycemic prescriptions because your blood sugars could drop too low, right, in those cases. So what does the research suggest? Well, there is some research, and in animal studies, which we are not animals, right? So a lot of times there failed to be a generalization to humans when we do animal research. But they have found radiosensitivity, so radiation was more effective in mammary tumors with alternate day fasts. Okay, so really preclinical data, not very compelling. It seems interesting, but it doesn't speak to healthcare making decisions, right? During chemotherapy, not all, but some of the chemotherapy regimens, there may be an improved efficacy of the treatment during a short-term fast. So we call that sometimes a fasting mimicking diet. And women with breast cancer, according to the research, who fast for 13 or more hours per night, so overnight, nice long fast, there is some evidence that it lowered their risk for recurrence of their breast cancer. So interesting, right? Most research suggests that medically supervised fasting regimens are safe. So I did list some side effects on the last slide, but most of the research shows that they're feasible, so people can do them, and that they are safe, relatively safe. But what do the experts recommend? So here's the thing. If you're thinking about a fasting diet, you got to talk to your healthcare team. You must, right? I would not advise this for someone who has malnutrition or is at high risk for malnutrition. And we see that very commonly with cancers of the pancreas, lung, head and neck, esophagus, gastrointestinal cancers, and then anyone with an advanced stage cancer, they are at greater risk for malnutrition. So by the way, if you fall into one of these categories, please ask your care team for a referral to a dietitian because they can help you prevent or treat your malnutrition. And you're going to do better with treatment if that's the case. It is recommended anyway to have a dietitian on your team, especially if you're thinking of fasting, okay? Especially if you think you're at risk for malnutrition. At this point in time, we do not have any definitive guidelines because we just don't have enough evidence yet. So we cannot recommend fasting, and we cannot recommend that it needs to be part of your treatment. For most part, clinically in practice for me, if someone's interested in fasting, we'll talk about it as a team, and we come together and we make a decision, and then we go from there. Okay, but it's not sort of like a part of the protocol of the plan at this point in time. There may be more important ways to improve your outcomes. Do keep that in mind, especially during treatment, by nourishing your body. So if the fast is appealing to you for some reason, you might want to ask that question to your care team is, are you doing everything in your power to help yourself to have the best outcomes as a result of this diagnosis? I think that's an important conversation to consider and put all the options out on the table to make sure you're checking off all of those things. Okay, I'm going to wrap up with keto. Thanks for staying. All right, so ketogenic diet. Hopefully you agree this is the most interesting part of tonight. So ketogenic diet, it's high fat, but moderate protein. And you probably know this, it's a very low carbohydrate. Not even just low carbohydrate, but very low carbohydrate. So here's the macronutrient range. So for some of my savvy members in the audience, you might know your macros. So typically, really the most strict keto diet is a 4-to-1 ratio. And I'm not going to explain what that means, but if you are so savvy, you might know that. So it is 80 of the calories that are consumed, 80 to 90% of those calories come from fat. That's a lot. Most diets are recommended to be about 30. And then the rest are 8 to 15% protein and a measly 2 to 5% carb. Now, I mentioned this about protein because if you are in the same camp as many people I work with are, you agree that protein is the best thing we could possibly eat. There's a little bit of an obsession over protein. We need it. We got to eat it. Where do we find it? I need more protein, right? Now, a keto diet is not high protein. It's actually only moderate because remember I mentioned in the first myth, if we eat too low carb, but too much protein, that extra protein gets used to be turned into glucose or sugars because there's no carbohydrates to use. So the body says, hey, I'm going to take the extra protein you're eating and I'm going to use it for sugars. So good to know, right? And that's really a very clinical high level, again, piece of information for you. So general healthy diets during treatment. This is what we look at in terms of a macronutrient range. We basically give a range, right? Because there's nuances and there's the opportunity for you to decide what will work best for you. So 20 to 35% fat, 10 to 35% protein, and the majority coming from carbohydrate, right? We can dip lower. We can dip to 45% if you want. Most carbs in a keto diet are avoided. So fruits, whole grains. I don't know about you, but they're delicious. They're part of my regular diet. and they are known cancer fighters, fruits and whole grains, right? The diet itself will supply less glucose for cancer cells. Now, a medically induced ketogenic diet requires medical supervision. And trendy community keto diets, because there's so many that are out there, they likely aren't cutting it. They are not creating a medically induced state of ketosis or keto adaptation, and that's necessary. If you're trying to shoot at a target, you have to hit the target, right? And if you're not medically inducing this diet and monitoring it clinically, you don't even know if you're in this ketosis, because what happens is when you keto adapt, you no longer spill urine ketones. So you can't check your urine for ketones. You actually have to check them through capillary means. So that requires a meter to do that. So keto diets, there are some side effects that are associated with it: nausea, vomiting, lethargy, GI discomfort, hypercholesterolemia, kidney damage, kidney stones, bone mineral loss. So not without side effects and concerns. Certainly can promote weight loss and cachexia. And cancer cachexia is a wasting syndrome that I work hard in clinical practice to avoid, because it causes up to 20% of our individuals who die from cancer. They die from their cachexia, not from their cancer, which is a shame. So here's more to the story about keto. 6% of people who follow keto may develop kidney stones. So good to know, might be contraindicated for someone who has a history of kidney stones. Nutrient deficiencies are common. So selenium, copper, and zinc are the most commonly found in the literature. And because the diet is so restricted, dietary supplements are advised, right? There's an exception there. Calcium and vitamin D may need to be added in supplemental form as well. These are some examples of recipes from actually the Charlie Foundation, and they're examples of ketogenic recipes. So this first one has some eggs, but it also has ham, some heavy cream, and some coconut oil. This middle one is like a deli wrap. It's basically more processed meat wrapped in some iceberg lettuce with a little dressing on the side with some oil added to the dressing. There's always this addition of oils and fats to change the macros. And this last picture on the bottom right, those are actually chicken nuggets. And instead of the breading, they use egg whites that are mixed with almond flour. But the chicken is mixed with heavy cream, olive oil, and butter. It just doesn't stop, right? More and more fat. So you can imagine that's not very appetizing as well for some people. Now, what does the research suggest? There is no known research at present where we can recommend. It's sort of like fasting, like we just don't know. The theories are out there, but we don't have any evidence to date, and they've been looking at this for quite some time. It's not like this is brand new information. The diet itself has been shown to be safe to follow. However, this is another example of when a dietitian needs to be on the team if someone's deciding to pursue this, because nutrition status and side effects need to be very closely monitored. Appropriateness needs to be evaluated because there are some relative contraindications. So that would determine if someone should not even do it or if they should. The keto diet is another example of how it might be a consideration for only a specific cancer type. Do you know what that is? And that's actually brain tumors or gliomas. And in preclinical data, brain tumors have been shown to not be able to use ketones for a fuel source. So only brain tumors, right? So that example of how cancers can pivot and adapt and have metabolic flexibility does not apply to brain tumors. For brain tumors, they seem to lack that plasticity or that ability to adapt and use other fuel sources. They seem to only want sugar. So ketones and giving that brain tumor only ketones might actually help with treatment, right? So they are a very unique situation, and really the one exception where the keto diet might be promising in research. And that's where a lot of the research up to this point in time has really shown maybe some benefit. And I say maybe because, again, we're still not at the point where we agree it's a standard of care. So what do experts recommend? So diets that are designed to help lower insulin levels, whether it be through keto or a low carb diet or intermittent fasting, they haven't yet demonstrated improvement in cancer specific outcomes. They help lower insulin and they might help lower inflammation, but does that translate to better outcomes? We haven't seen it happen just yet. So in the future, just like treatment has been targeting specific cancer pathways, which is really fascinating, we might eventually know that there's some targeted approaches for diet and physical activity that similarly can improve outcomes as well. So research, keep this in mind, it progresses one step at a time, and it takes a long time before evidence can build. And we're at the very beginning of the journey to understanding and exploring how diet and physical activity can optimize cancer treatment. So stay tuned. It's my job to help you understand if something's worth your while. Okay, so in summary, just want to remind everybody that no single food causes or cures cancer. A diet pattern seems to be what matters most for cancer protection. Nutritionists, health coaches, diet experts, they are just check, are they a registered dietitian also? If they don't have clinical oncology experience, they might not be as qualified to be dispensing advice. The best guidance is tailored to your unique situation by a qualified expert. And oncology dietitians, they may already be on your team. You may not be aware of them. So check with your oncologist. You can ask for a referral. Very often they're included as part of your care and they don't bill for their services. So if you agree, they're critical during treatment and beyond. And our goal as a group of oncology dietitians is to protect you from the misinformation that you might be exposed to and actually empower you not to be afraid of food, but to harness the power of food and nutrition in a way and towards a life that serves you, both mind and body. These are my favorite resources that I hope you'll get to explore a little bit more for yourself. So Food Facts is really a great organization. They're a nonprofit and they're just really fighting back against misinformation. How to spot nutrition misinformation, AICR, I referenced a couple times. If you're looking to know more about dietary supplements, the FDA has a pretty nice website full of information. And then a little bit more from the World Cancer Research Fund about milk, dairy, and cancer, if you're curious to learn more about that. Now, I want to thank you for attending this evening, and I promised I would share my work email at Cancer Wellness Center. It basically is my personal email. You're welcome to reach out to me anytime directly. I'm happy to help. I'm here to really help you feel more confident and to empower you. And thank you again for attending.